Joining me now, board-certified emergency physician, Dr. Jared Ross. Doctor, thanks for being here.
Hey, Rick, thanks so much for having me on.
In layman's terms, can you explain an aorta tear?
An aortic dissection is when the aorta, the biggest blood vessel in the body, rips. And that usually happens due to chronic stress on the aorta. That's from high blood pressure or from a previous ballooning called an aneurysm. And we know that older men are at highest risk for that, people who smoke, and also people who have cardiovascular disease. And we do know that Senator Graham was 71, a male, and did have some vascular disease as well.
Well, the ME says toxicological and microscopic testing results are still pending. What will those tests help determine, and what do you expect to learn from them?
I honestly don't expect to learn too much from those tests. I think that, given the autopsy results, that he had an aneurysm that, or a dissection, likely from an aneurysm that tore. I think that's likely what caused his death. Unfortunately, aortic aneurysms tend to be fatal. They can be treated if they're caught early, but unfortunately, most of them are fatal. I think the reason to check the toxicological.
Go ahead. I'm listening.
Oh, go ahead, Rick. I think the reason to check the toxicological testing is because there were some concerns about death threats against him, and to make sure that there was nothing that was in his system that may have put additional stress on his heart. But I think that's fairly unlikely.
Well, a couple things on that. First of all, people with a family history of heart disease are more likely to develop cardiovascular disease, as I understand it. And Graham's father, Florence Graham, died from a heart attack at age 69. Lindsey Graham was 71. I wonder how much genetics might factor into this. But to your other point, which I wanted to ask the senator about, there are some suggestions that maybe this could have been some sort of assassination on the senator, since he was in Ukraine, which is at war with Russia. Russia is an ally of Iran. In Iran, they were calling for the senator's death, and Russia has been known to take out opposition political leaders in the past. So you don't think that's likely? Tell me more about that and about how big a role genetics play.
Genetics absolutely plays a role. We know that some connective tissue diseases, even some subclinical variants of something called Ehlers-Danlos syndrome that people might not know they have, that can cause aortic aneurysms and aortic dissection. But the fact that we've got a U.S. performed autopsy showing that he had an aortic dissection really leads me to believe that that's true, and that there isn't really any substance that you could give someone to cause that to happen overnight. I mean, a stimulant could put additional strain on someone's aorta who already has a ballooning or an aneurysm, but really unlikely to be able to cause a dissection. And again, this autopsy was performed here, so we know that there's no misinformation coming out from the autopsy itself.
Dr. Jared Ross, we appreciate your expertise. Thanks for joining the show.